Hello, my name is Mario Kapusta. I am a cardiovascular surgeon, presently practicing at Texas Vein and Wellness Institute. I am the cosmetic specialist at Texas Vein and Wellness Institute. When patients come with any kind of vein cosmetic problem, I personally examine the patient, converse with the patient, and in cooperation with the patient, make a plan of treatment. So once diagnosis is made in cooperation and conversation with the patient, we will choose a path of therapy. At Texas Vein and Wellness Institute, we use particularly two methods of treatment. We use sclerotherapy, which is injections inside the veins, which irritate the inside of the veins and makes them close, and also laser therapies. And the laser is a high intensity beam that heats up the vein and closes the vein. By eliminating the blood inside the vein, then the spider or reticular veins are not seen, and that is the desired result. Occasionally then, we have patients that have spider veins on the face, and those are treated again with lasers with satisfactory results. And also, we have recently started treating hand and forearm veins using sclerotherapy. That has been a very, very rewarding side of our practice. Patients are very satisfied with the results. They can again show their hands and arms without covering them in sporting events and night events. So we're happy with those results. All the treatments are done in the clinic. Patients are awake. There is no anesthesia involved. For sclerotherapy, we clean the skin with alcohol, and then using the smallest needle available in the market, we enter the vein, inject the solution, and magically the veins go away. Then sometimes, if the patient so desires, we will treat those veins immediately after that with laser, and the double injury does a much better job than either therapy by itself. In the face, we use local topical anesthesia. So it's because the face is very sensitive, particularly around the nose and mouth. And in the hands, we have there's no anesthesia used. Patients go back to their activities immediately. I suggest they can go back to the gym that same afternoon. Okay, with hand veins, I recommend that the patients do not lift weights for approximately 5 days. For face therapy and laser therapy of the extremities, there is no downtime. The patients can go back to their activities right away as they leave the clinic. For the facial treatment, as well as other places where we use laser, redness is not permanent, but it happens for a couple hours after the treatment. Again, patients go back to their activities as fast as they possibly can. The reason patients develop problems, cosmetic problems in the lower extremities, has to do with their parents, their gender, the weight, the job, and the type of skin. Occasionally, there is an underlying condition causing the problems in the lower extremities. That is, larger veins, sometimes seen, sometimes not seen, may not working perfectly well and transmitting the high pressure from the veins all the way to the spider veins under the skin occasionally. Under those conditions, an ultrasound of the extremity will reveal the problem, which should be treated prior to treating the cosmetic problems. For the face, the spider veins in the face, it is all the situations that I mentioned earlier, family, jobs, etc., but also exposure to sun. So, and one of the issues, my recommendation is always being to treat these conditions, because as time passes, these conditions get worse. That is, patients will have many more spider veins, more difficult to treat. The spider veins will recruit additional areas of veins. So the earlier, the better, and it will be more satisfactory results. So if you have any questions, or if you wish to come and see me, please contact us on our website. I'll be happy to see you for problems big and small. It doesn't matter. We'll help you, and we'll help you have the best result possible. Thank you for your attention.